Hello, my name is Carrie Allen and I'm a pharmacist. I specialize in geriatrics. So today we are going to talk about vaccinations / immunizations, same thing, for older adults. Why should older adults get vaccines? Well, I mean, generally speaking, it's the same reason anybody should get vaccines. We need to protect ourselves and we need to protect others, this sort of herd immunity, people that you're around. If you're protected, then they're more protected. If they're protected, then you're more protected. So for all of us, it's very important to get vaccines so that we stay healthy. Older adults actually, though, may have a weakened immune system, and that can vary from adult to adult. One older adult is not the same as another older adult. However, it can be more difficult for older adults to fight off infections. So we're trying to protect against infections through getting vaccines. When you're an older adult, you may have increased susceptibility to the flu, the respiratory type of flu, pneumonia, and shingles, especially if you have a chronic condition. And these days, who doesn't have a chronic condition, such as diabetes or heart failure? So you're at increased risk not only for contracting these diseases, but for getting complications that can lead to long-term illnesses and hospitalizations and death. And I think that's really the key part. When I talk to people about vaccinations, they often have stories such as, oh, well, I got a vaccine and then I got the flu anyway, or I got sick anyway, or I got the vaccine and I didn't feel good for a couple days. But the thing of it is yes, we absolutely do want to not get the diseases. Oh, that's the goal. However, if you get around the disease, you get exposed to the disease, and you happen to contract it, your response is boosted by these vaccines, so you're less likely to get very sick and have these complications I just talked about, such as hospitalization and death. You're likely to fight off things a little easier. And so that's really the point of vaccines. They're not magic, but they help boost the immune system against things that we know we're going to be exposed to, especially as older adults. Vaccines can protect you from serious diseases and complications. Again, think of your family, think of your friends, think of your coworkers, think of people you're around. It's not just about you. Vaccines can help everyone. This is kind of a busy slide, but it's sort of a one-stop shop. So if you're a slide person or you like to print things out and look at things, this gives you a very quick and easy overview of what goes on and what we're going to talk about. So there's a few common vaccines that we think about for older people in general, and they are the flu vaccine, again, the respiratory flu, pneumococcal vaccine protecting against getting respiratory infections, pneumonia, but also meningitis type pneumococcal infections. Shingles, which is a rash, a painful rash that can lead to many complications for months, or sometimes people even say years thereafter, where you're feeling tingling, itchy, painful things that go on and on. My mother actually has had shingles. I've had shingles twice. So it's not just older people that are exposed to it. So this is a vaccine I'm personally very interested in, and we'll get to the age restrictions with that in a minute. Tetanus, you've probably heard of that, protects against lockjaw, and it comes in a bundle with other vaccines. So diphtheria, which is severe infection of the nose and throat and airways, and pertussis, which is whooping cough. Well, if you'll recall, we hadn't heard about whooping cough for a very long time, and then now it's back. So definitely make sure, if you haven't had that type of immunization in a while, that you look into getting a booster. And again, we'll talk about more of that later. Hepatitis A and Hepatitis B are talking about that serious liver disease. Hepatitis A typically coming from food, sort of fecal matter to mouth kind of exposures. Hepatitis B is a little bit different, contracted usually through body fluids. So when we're thinking about protecting you against diseases, these are the ones that really are the high hitters, although there are certainly more. With the influenza vaccine, you're going to get that every year because the flu changes for the most part every year. There's that east to west transition, and there's different viruses that are involved. Everyone 6 months of age or older should get a vaccine for the flu every year. Now, I'm going to say this and then I'll say this again later. The CDC does not specify a preference for a vaccine type for older adults. You'll hear a lot of hype one way or another, but think about your friends, think about your family, think about community, like I said, and think about getting the vaccine that's available to you, that your insurance covers, and you should be pretty well covered. Pneumococcal vaccine, it's a little tricky. There's two that you get, and you get them at different times, and we'll talk about that. 65 and older, definitely want to get that. Shingles, 50 years and older, depending on which vaccine you get. There's two different kinds. Tetanus, you're going to get something called Tdap, one time, and then a Td booster every 10 years, and or if you get certain injuries. If you're out there welding, playing with rusty metal, who knows what, and you get punctured, you're probably going to need a booster anyway. Hepatitis A, older adults with specific conditions. Hepatitis B, again, older adults with specific conditions, and healthcare workers need to get hepatitis B shots. So let's move on to everyone's favorite topic, the flu vaccine. Always a hot topic, especially after 2017. That was a prolonged and intense flu season. People were dying, people were very ill, and many people had not gotten the vaccination or hadn't gotten it in time. So you want to get it every year. Again, it changes to help prevent getting influenza, but also spreading it to others. So think about if you're around little kids, if you're around other people who might be frail, family members. If you have a weakened immune system, definitely want to think about getting this vaccine. People get very sick. Healthcare workers as well. So who should not get the vaccine? If you've had a very serious reaction, life-threatening reaction, you want to consult with your doctor, but generally speaking, they recommend against you getting another vaccine. But we're talking a severe reaction. Not, oh, I didn't feel good, or I had to lay down for a couple days, or I couldn't move my arm, which doesn't usually happen with influenza vaccines. But the swelling of the mouth and throat, anaphylaxis, just unbelievable life-threatening rash and skin and throat reactions. These are the type of reactions I'm talking about. And make sure that you know that you've had that reaction specifically to a flu vaccine. Talk with your doctor about it. Nowadays, almost everybody can get the flu vaccine, even if you've had an egg allergy or something in the past. There's different kinds out there, so we try to just give you something that has a little less or none of what you're allergic to in it. And nowadays, they want everyone to be watched by the person who gives you the vaccine for a good 15 minutes or half an hour, just to make sure that no one's getting a reaction. That's just having to do with adverse event reporting and better judgment and doing best practice with the influenza vaccine. This is kind of an interesting slide to me in the sense that it has all these viruses that we talk about on the news, and normally when I'm giving information on infectious diseases, there's all these viruses and these things that you talk about, and it's a lot of jargon and a lot of blah, blah, blah. But I find nowadays, sometimes when I say H1N1 virus, people have certainly heard about it because it's been on the news. So there's really two kinds of flu vaccines. One is trivalent, so it just has 3 little antigens out there that your body is producing antibodies to, so it's already geared up to fight against the flu. And that's the H1N1, the H3N2, and the Victorious strain virus. Those 3 are in there. Then there's a quadrivalent, so it has one more little thing for your body to provide antibodies against and be able to fight against. So that sounds pretty good. It's got the same things as the trivalent, so the H1N1, the H3N2, the Victorious strain virus, but it also has the Yamagata lineage virus in there. And these are just little antigenic points, which means that they are something that your body recognizes as foreign. And when your body recognizes as foreign, it creates a little army in your body to fight against it in case it sees it again. That's how these things work. So, you might think, well, the quadrivalent has more, it's definitely better, versus the trivalent, which only has 3. And some people think that. The truth of the matter is, one hasn't really been proven to be better than the other. And as I said, the CDC doesn't recommend one over the other. They certainly have some that are specifically aimed at those who are 65 years of age or older. But again, if you think about herd immunity, community immunity, right? If you get the vaccine that is paid for by your insurance, that is easily available to you, you get it before there's any kind of shortage or anything like that, you're gonna be very well protected. And that's what we're really looking for here. If you have a specific preference and you want to ask for one or talk to your doctor about one and they have a preference and you want to get that one, maybe you'll have to pay a little extra, maybe not. And that's the one you can get. That's completely fine. I put some brands, it's not all inclusive, down at the bottom there just to let people know what's out there. In particular for the Trivalent, we have the Fluzone High Dose for people who are 65 and older, Fluad for 65 and older as well. And then if you look over at the quadrivalent, one of the brands is Flu Mist. Now this is not for people 65 and older. This is a live vaccine. The other ones are all attenuated, meaning they're just parts of an actual virus, but not live virus. This one's a live virus. Goes up your nose. It's only approved for people 2 to 49 years old. So we don't generally recommend it for people who are 65 and older, and we don't generally recommend it for people who have numerous chronic disease states. So when should you get the vaccine? This is an interesting point, I think. We all think at the beginning of the year, I'm going to get the flu vaccine if we're so inclined, and then something happens and you think, oh, well, I've missed my October window. For whatever reason, we're all focused on October, even though the flu season goes from October through March. So you could get it at any time and get protection, especially if you know you're going to be traveling or seeing people that have been traveling, always a good idea. However, people they think, oh, I didn't get it at the optimal time and I'm just not going to get it. That's probably not a good idea. Get it anytime during the flu season. Ideally, though, because of the way vaccines work, you got to form that army, right, that can get out there. So you got to get exposure. You get it about 2 weeks before the flu season really gets into full swing, if you can. So that's October. Does that mean you shouldn't get it later? No. But if you can, get it, and in about 2 weeks, your body will have built up those antibodies, that army, to fight against the flu when it gets exposed to it. And you'll probably be exposed to it by numerous people in numerous ways. So develop that immune response. So if you can, try to get it before the end of October, but don't forget to get it. Remember last year, again, 2017, when the flu season went on and on, it went into May, and it was very severe. One of the things that I was asked and other people were asked in the healthcare field was, should I give a booster? So let's say you got the vaccine in October, but should you get a booster, another version of it, or the same version of it in May or March, a little bit later? There have been no studies that prove that that's effective. There are some doctors for certain patients with certain disease states who will do that, but that's a very limited practice. It's generally speaking not something that we do. Now, pneumococcal vaccine. This is the one I said was a little tricky in terms of the schedule, but I'll work you through it there. So pneumococcal vaccines, again, protecting against pneumonia, infections in the lung, in the blood, including the covering of the brain, like I mentioned, the pneumococcal meningitis. So people need 2 types, and this is our older adults. Generally speaking, unless you're very immunocompromised or have a specific disease state, you don't get this if you're under the age of 65. There's something called PCV13 and PPSV23. Rather than me going through and saying that and being confusing, I'm going to say Prevnar 13 and Pneumovax. So Prevnar 13 is PCV13 and PPSV23 is Pneumovax. Let's stop saying those complicated terms. So talk to your healthcare professional as to which one you should get, and keep records on this one for yourself. Remember when we all used to get vaccines as a kid and they would give you a little book. and you would keep it. I still have my little book of vaccines. I know we have electronic medical records and things are supposed to transfer, but that's not always the case. And since there's a specific order and way to do these vaccines, it's just so much nicer if you can get maybe a printout or write it down as to whether you got the Prevnar 13 or the Pneumovax and the dates, and keep track of that if you or your caregiver can do that. So again, 65 and older, if you have a chronic condition, so asthma, lung diseases especially, liver, kidney disease, sickle cell disease, diabetes, you definitely want to be looking into this. You want to prevent getting pneumonia, or at the very least, stop getting really horrifying complications from it. Pneumonia is no joke. People with cancer or weakened immune systems are definitely candidates for this. People with a missing or damaged spleen. People who have cerebral spinal fluid leaks or implants in their ears. People who have chronic alcoholism or smoke cigarettes. So all of those things are risk factors for getting pneumonia, and you want to protect against that. So again, the CDC recommends this Prevnar 13 and the Pneumovax for all adults 65 and older. And so this is the schedule. It's going to be confusing, but I'm going to lead you through it. So you're going to get 1 dose of Prevnar 13 if you're 65 or older, if you've not previously received a dose. So never received a dose of Prevnar 13, you need a dose. Then you get a dose of the Pneumovax, the other vaccine, a year later. Well, let's say that you've already had a dose of the Pneumovax. If you've already had a dose of the Pneumovax, then you're going to get a dose of the Prevnar 13 at least 1 year after you've gotten the Pneumovax vaccine. That is a lot to work through. We can make an interactive chart for you if you want, but the CDC does have a lot of good imagery out there, and your doctor and healthcare professionals should know what to look for. But like I said, keep a note. Keep a note of which one you've got. Shingles vaccine. Like I mentioned, both my mother and I have gotten shingles, and it is really not fun. It's painful. It's itchy. It swells. It blisters, and it's a reactivation of the chickenpox virus. Even people who have gotten the vaccine for chickenpox in their lives have actually ended up with shingles. It's just one of those things that pops up usually if you're under extreme stress, you're immunosuppressed, you have a lot of chronic diseases, you get sick with some other disease, and then shingles comes on, and it's just not fun. And what will happen is after those blisters heal, you'll get this tingling pain, and it may last for months, it may last for up to a couple years, people have said, but it's very uncomfortable. For some people, they can't even put on clothes or lay on their backs, wherever that happened to be on their body. So if we can prevent getting this, you want to prevent getting this, or at least minimize your risk for getting it. So the CDC recommends that healthy adults 50 years and older get 2 doses of the shingles vaccine called Shingrix. Now this is a newer vaccine. It's a recombinant zoster vaccine. So zoster is the virus, and they did a little manipulation of it genetically, which makes it recombinant. And the thing with this one is it's a 2-dose vaccine. It's separated by 2 to 6 months. You get one, you wait 2 to 6 months, and you get another. And this prevents shingles and complications. I mean, it's very effective. The stats on this are upwards of 90%. So talk to your doctor and pharmacist about shingles and see which one you might be able to get, because there's another one. Shingrix, and I'm going to skip down to sort of the second part of the slide here. Shingrix is the preferred vaccine per the CDC over Zostavax. Zostavax has been around for a while, and it's just a one-shot deal. It's approved in healthy adults 60 years and older. So you could use Zostavax if you were allergic to Shingrix, or if you just prefer Zostavax, if you're someone who says, I'm only going to get one shot, and I know I'm only going to get one shot, then that's probably the one you're going to get. Or if you request an immediate vaccination and Shingrix is unavailable, then that's certainly a time to get Zostavax. There's lots of cost-effective items going on out there, and the idea of, oh, okay, well, 50 years versus 60 years. I'm not quite 50 years yet, but I'll tell you, I want one of these vaccines. So I'm going to try to go out there and see if I can get one. I might have to pay for it, but that's the thing. If you're 60 years or older, then they'll pay for both. If you're 50 years around that, but you're not 60 years yet, they're probably not going to pay for the Zostavax, the one-shot there. So think about that, and then let's talk about the side effects of Shingrix. Anytime you get a shot in your arm intramuscularly, you know, sometimes you can't lift. There's all these side effects that go with it. We usually all live through it to tell the story and complain about it, and it's fine. Shingrix, from both the literature and reports that I've heard from friends and family, is a little more painful than your average injection. So if you are needle shy, you want to make sure that you take that into consideration and prepare for it. It's not debilitating or anything like that, but there definitely have been reports of muscle pain in the area, swelling in the area where people have been injected. So definitely don't pick your dominant arm that you use a lot, or plan to not do very many dominant things for the next couple of days. And you know, sometimes people will get a little bit of a, I'm not feeling so good after getting vaccinated. That's your body gearing up when it's exposed to things, building that army to fight against them. So that's completely normal. Just keep an eye on it if it happens. If you decide that you want to look into getting the Shingrix vaccine, you want to just make sure that you talk with your doctor first to make sure that there's no reason why you shouldn't get it. You notice I said healthy adults. We give it to people who have multiple comorbid diseases. So if you have you have diabetes, you have COPD, you have all of these things, we do give it to those people, but you want to make sure you're in a healthy state when you're getting it. Tetanus, diphtheria, pertussis, Tdap and Td. Who should get these? Well, everyone, but people 65 or older, a booster if you've already gotten the Tdap, which you probably have. But if you look back at that little childhood immunization book, if you have that available and you haven't gotten it or you're not sure that you've gotten it, it's not going to hurt you to get it again. It's good to be protected against whooping cough, against lockjaw, tetanus, all of these things. If you are a healthcare worker, again, or you have contact with infants younger than 12 months, you definitely want to make sure that you've gotten this vaccine. Now, you might also need a booster, as I mentioned. So you might get one dose of the tetanus, diphtheria, and pertussis, the Tdap, and regardless of when you've had the vaccines before. And then after you receive that Tdap, you'll need a Td booster every 10 years, or if you happen to come in contact with any rusty metal that's penetrating through your skin. Hepatitis A vaccine. So these next two slides are going to be talking about, or next few slides are going to be talking about those liver diseases that these vaccines protect against. So hepatitis A protects hepatitis infection, so your liver infection. And hepatitis A can cause jaundice, that yellowing of your skin because there's something wrong with your liver, diarrhea, fever, and weakness that can be severe. If you are someone who wants protection in general against it, you think you might be exposed, you are someone who should get this. People who have chronic liver disease and a blood clotting disorder should get this vaccine. People who use drugs, men who have sex with men, people who travel outside the United States to places where hepatitis A is common. And there's a website off the CDC where they will tell you exactly where those places are and how common it is to come in contact with hepatitis A. Hepatitis B can protect this hepatitis B infection. And hepatitis B, because it goes on and on and on, there's no cure for it, can cause liver disease and liver cancer. What happens is that your liver keeps trying to fight it off and fight it off. It's susceptible to it. It changes cells over a lot, and whenever your body changes cells over a whole lot, sometimes the regulatory mechanisms that keep the cells doing what they're supposed to be doing get out of whack. So all sorts of chaos ensues intracellularly and cancer develops. So we really want to protect against this. Anyone who wants protection against it in general should get it. People who are at risk by blood or mucus exposure, so if you're a healthcare worker, if you're a caregiver, if you use injectable drugs, those kind of things, you want to get this vaccine. People who are at risk by sexual contact, so sexually active persons that are not in entirely monogamous relationships should worry about this. Men who have sex with men, people living with someone who has hepatitis B, because you never know when some sort of cross-contamination can occur. People with end-stage kidney disease on dialysis, have chronic liver disease, have diabetes, have hepatitis C infection, alcoholic liver disease, cirrhosis of the liver, HIV, definitely need to get this vaccine. And it's a series of 3 different shots over a course of time. So you have to commit to getting it, but it's not too bad. It's a good vaccine. If you are working somewhere as a healthcare provider for anyone who has a sexually transmitted disease such as HIV or hemodialysis, people with developmental disabilities, people who you might come in contact with their fluids, you definitely want to get this. And then again, people who travel outside the US to places where hepatitis B is common, and the CDC has a list for that as well. Vaccine side effects. This is one of the most fascinating points, I think. You know, we went over some of the side effects. You're going to have localized, sometimes problems from where they give the injection. You're going to maybe feel a little fatigued here and there, and while your body's making that immune response, and that makes sense. However, we have a vaccine adverse event reporting system, and that's listed here on the screen. So you could file the report, or your doctor could file the report. And what I think is so important is that consumers file reports about adverse effects. When they do studies on vaccines, or when they do studies on drugs in general, you know, you see all the side effect profiles. If you see commercials or you're reading any literature, you see all of this. Most of that is coming from the very controlled studies they did in very controlled environments. I think everything I just said up until now is telling you that the rest of the world does not live in a controlled environment, and we're all at risk for various things, and that one older adult individual is not the same as another older adult individual. In older adults, biological age and chronological age are almost not the same from 1 to 1 to 1 all the time. So you, as caregivers or as older adults yourselves, are so valuable as a resource. If you have an adverse event, you have a specific rash, you have a feeling of limpness, you have anything that's an unusual event that you think might be associated with the vaccine that you've recently gotten, definitely should be reported. And again, you could do that yourself, or your doctor could do it. And I just want to put my thank you out there in advance to anyone who happens to have an adverse event, and I hope that you don't. But if you do, thank you very much in advance for reporting it, because it helps us all be better informed and will help people develop better vaccines in the future. Well, thank you so much for your time. I hope this was helpful, and I will talk to you next time.